right, so we wanted to start with just give us a quick background on the ASC. Can you tell us about how the ASC came about and how it has evolved since you've gotten here?
Okay, well, I'm Sharon Duke, and I'm the AIDS Service Center NYC first executive director. I was hired in 1990, and we received base funding from the New York State Department of Health, the AIDS Institute. And our first grant was $200,000 with 3 staff, no direct services, and a mission to coordinate care within Lower Manhattan. And I'm very proud to say that over the past 19 years, we've evolved into a multi-service, multilingual, multi-site, multi-million-dollar organization. In 2008, we served 2,600 New Yorkers living with and affected by HIV and AIDS. We conducted over 2,000 HIV tests, identified folks who were HIV positive, connected them to medical care, and we run a peer education and training program that is a 2-month training for people, many of whom are living with the virus, all of whom have been affected by AIDS and HIV. And graduates of the training program enter internships, and we offer around 50 paid internships every year. And peer interns help ASC extend our reach into the community. And in 2008, our peer educators conducted over 4,000 community prevention education programs.
Well, so much has changed since you started, not only here at the ASC, but also with how we look at the disease and how we treat the disease. Now it's considered much more sort of a chronic long-term condition rather than a gateway to a terminal illness. But people still die, of course, from AIDS. So how has the perception led to maybe some complacency or some, doubt amongst not only the general public, but also about how it is being funded by, things that you rely on, such as grants and, the federal government?
Well, I do think that the treatment advances have been really remarkable and have increased survivability with the virus that causes AIDS, HIV. And that has been really incredible. And with the treatment advances have come the need for different types of services. But I also think what you said about complacency, that there is a public perception that AIDS is no longer a crisis. And because there are treatments available, there's also a public perception that that AIDS is no longer a fatal disease. And unfortunately, it is. And there is still no cure for HIV. And HIV is ending people's lives well before they run their natural course, and really shortening the years that family and friends should be able to spend with people who have HIV. So I think that the complacency has really had a negative impact on prevention efforts.
So with that said, where do we stand in the case? How many new cases are reported per year? Is it on the rise, is it decline, or has it sort of flatlined?
Let me see. New HIV infections in New York City are rising at 3 times the national average. There are 100,000 New Yorkers who are living with HIV today, and 1 in 4 people living with HIV do not know that they have it. 25% of New Yorkers living with HIV are not aware of their status. 1 in 3 HIV positive New Yorkers are women, and more than 75% of New Yorkers with AIDS are people of color. With the treatment advances, there are fewer deaths per year, and the death rate from AIDS has declined. However, as people are living longer, their health issues are becoming much more complex, because not only are they having HIV-related issues, but they're having issues related to growing older, like high blood pressure and liver disease and cirrhosis and cancer and diabetes. So there's multiple health issues that need to be addressed.
So what is, in terms of World AIDS Day, what does that mean to the ASC?
World AIDS Day for us is really a time to to step back and to remember those who we've lost, really pioneers and leaders in this epidemic. There's a saying, we stand on the shoulders of those who came before us. And I think that World AIDS Day is it's a wonderful occasion with which to honor their memory and celebrate their lives and reassert our dedication to fighting this epidemic so that there will one day be a cure and there will no longer be a need for organizations like ours.
What does the ASC, I guess, need right now, or what needs to happen right now so that the ASC can keep going forward and keep improving their programs and keep growing and helping people?
Well, I would say donations around basic needs, whether it's non-perishable foods, whether it's clothing, if you have time, and certainly a monetary donation. www.ascnyc.org. Thank you.